Like a spotlight, Edgewenka, and I'm here with Mrs. Noeline Levens-Clark, a National HIV/AIDS Program Coordinator. Good to see you. I'm going to make you a co-host.
You mean depending on the frequency of visits?
It's after you here, you know, you could be a co-host now.
Well, who knows?
That's true.
Yes.
But I mean, you're good at it.
Well, thank you. Thank you.
So good to see you.
Yes, thank you.
Regional testing day is coming this Friday. How are you preparing for that?
Okay, Caribbean Regional Testing Day is an initiative that is observed by every single Caribbean country. And it's where we scale up access to HIV counseling and testing. So this year, in the BVI, we have decided to do our sister islands on the Wednesday so that we can concentrate on Virgin Gorda, Anegada, and Jost Van Dyke separately. I'll be going over to Virgin Gorda. It's my first opportunity to go, which I'm happy for because it's my homeland. And we'll be providing HIV counseling and testing to the Virgin Gorda community, Anegada community, and the Jost Van Dyke community. And then on Friday, for the first time, what we have done in collaboration with Scotiabank BVI was to expand our offerings. And so we'll be not only be providing HIV counseling and testing, but we have many community partners that we are working with. The BVI Health Services Authority, they'll be providing blood pressure checks, weight and BMI calculations to see if you're overweight, underweight, just the right weight. And then the BVI Diabetes Association, they'll be providing blood sugar and cholesterol screening. Then you come over to the National AIDS Program, and the same sample with which we take the blood sugar, the sample for blood sugar, we will use that same sample to do HIV testing. So you won't be pricked more than once.
Oh, okay.
Yeah, we're organizing so that persons can get stick once but have at least 3 tests done.
Oh, you get stick one? Oh, that's good.
Yes,
yeah.
you make it easier. Community mental health will be there to teach us ways in which we can keep our minds and emotions balanced. Nutrition and nutritionists will be there for persons whose blood sugar, blood pressure, or weight is over extreme. Community dental health will be there to do dental checks. BVI Cancer Society will be there to advise us on cancer prevention. The Sandy Lane Center will show us samples of different types of drugs. La Ambiance Spa will be there to give us back rubs, neck rubs. And Scotiabank and the HIV/AIDS Foundation will be there to provide information. We will also have one specific tent just assigned to sexual health commodities. So condoms, dental dams, condom keyrings, all the sexy things that we need, they'll be provided right there and then. Music will be provided by DJ Dre, and we also have a new activity this year, Karaoke for Condoms. We're encouraging the BVI community to come out and sing. Show us your talent and you will be awarded condom packages.
Okay. And repeat again, this is going to be when and where? On
Friday. Okay, so Wednesday is the Sister Island. So tomorrow, Wednesday, which is July 26th, we'll be in Virgin Gorda at the Scotiabank in the Virgin Gorda Yacht Harbor.
Yeah.
And then at the Anegada Clinic in the Settlement Anegada, and at Jost Van Dyke Clinic in Great Harbor, Jost Van Dyke.
Okay, so tomorrow is Virgin Gorda, and that's tomorrow is Wednesday. Thursday is Anegada.
No. Wednesday is Virgin Gorda, Anegada, and Jost Van Dyke all at the same time. Sister Islands. It's a Sister Island Day.
Okay, so you're going to have different people
going to the different islands to do HIV testing. Our vision is, within the coming years, we will offer the Health and Wellness Expo to all the 4 major islands. But for this year, we're starting off with Tortola on Friday at the Noel Lloyd Positive Action Movement Park, beginning at 9 a.m. until about 3, where we would be having different types of screening and testing going on. Lunch will be provided by Mac Level Cafe, natural juices by Mellow Moods Cafe, and smoothies, local natural smoothies by Nature's Way.
This is a big event.
It's a big shindig. Nobody should miss it.
That's great.
Yes.
So what, in the few minutes we have remaining, what's been happening on the HIV scene? HIV now, it seems to be suffering from resources, the HIV programs. I know in the Caribbean generally it's suffering from resources. Because
the Global Fund came to an end for most Caribbean countries. Right. So they have to manage now based on their local budget to manage the disease.
So our budget's still intact?
We are still intact. We're still a part of the European Commission Overseas Territories Project, which ends in another year. And so we still have funding available to scale up HIV programming when it comes to prevention, treatment, care, and support. And that's what we're trying to do, establish systems. And that's why we had our policies implemented. We're trying to strengthen the health sector, strengthen our tourism sector, our education with health and family life education, whatever needs to be done in the BVI to ensure that when the money done or when it's finished, we can survive and we can manage HIV.
Okay. All of the things that we've been doing over the years,
Yes.
the National AIDS, HIV/AIDS program, what results have we been seeing?
Well,
what can we measure?
One obvious indicator that we see is a decline in our numbers. The goal of the project, and for every Caribbean country, was that by 2015, we would begin to see the spread of HIV lessening. So, like I said, in 2008, we had 9, 2009, 9, 2010, 7 new cases, 2011, 6, 2012, 5. This year, so far from January, we've had 5 new cases. So I'm just hoping and praying
That you don't get another
that
one.
we don't exceed. I'm just praying. But at the end of the day, it is what it is. If someone is infected, getting tested would let them know where they stand.
And that's the importance of this week of activities.
Yes. Yes, to encourage people to get their HIV test done. And we're appealing to persons who have never had an HIV test done before to come out. Men, women, boys, girls, come out. Have your HIV test done, know where you stand. So that if you're infected, you can get treatment and prevent yourself from progressing to AIDS. If you're not infected, you can keep it that way.
Yeah. And of course, now the testing is a lot easier.
It's much easier.
Yeah. And confidentiality is really not such a big issue.
It's not an issue.
No, because you can you can do your own testing.
You can do your own testing.
Doing your own testing.
The at-home test kits are now available. Persons can go online and order. It's still a concern for me, and it's a conversation I would love to have with the BVI community, because then we won't be able to have a handle on it. Persons will order the test, do their tests. If persons find out that they're positive, there's no way to validate that result. So they may get a false positive or they may get a false negative and not know whether or not they are infected. And then it begs the question, then persons might start thinking about suicide, you know, not that kind of thing. They're not able to cope because they have not accessed the support that they need.
But I mean, that's interesting. I never thought of it from that perspective. But how would you manage something like that?
It's something like I say, I would love to have a discussion with the community, but at the end of the day, it is beyond our control.
So you would say to the community, yes, you can get the HIV testing online, but
yes,
you would prefer that you come in
to be validated.
To be validated, I'll get the testing from an institution.
Get a confirmation from either health services, any private doctor, or even overseas. But go see a physician, get that result confirmed to ensure that you are infected, and if you are, when you can start treatment.
And if you're not, that you're certainly not.
If you're not, you keep it that way. You try your best to protect yourself.
Okay. Now, in terms of stigma reduction, it seems like we've been having some success with that as well.
Yes, we have.
Yeah.
Yes, we have. But because we have no baseline data, we have nothing, no evidence to go on. But in observance, talking to people living with HIV, I know in the past, like probably 2005, 2006, a lot of persons in this territory were either evicted from their apartments or deported because of their HIV status. Our government has shown political leadership in ensuring that discrimination stops in this country, and so we have our labor law.
How has that been done?
The labor law has been updated to say that no one should be denied a job in this country based on sex, race, HIV status. It's clearly stated in the document. Our constitution speaks to stigma and discrimination, and so anyone with HIV has our laws to support them having a life just like anyone else in this country.
But do you have, if you're HIV positive, do you have to let anyone know?
You don't have to. It's not
a requirement for applications, or
no.
There's a law against having to ask for that information.
No employer should force anyone to tell them what their HIV status is. It is up to the individual to decide that.
All right, cool. Now, HIV, there are a lot of people now living longer with HIV.
Yes.
So there's this move afoot to have it, I don't know if I could say downgraded, but certainly...
Not downgraded, reclassified.
Good, thank you. I figure you don't have the right word.
Yes.
Reclassify to a chronic disease or communicable chronic disease.
Yes.
How you see that? What you think about that from that perspective, and how would that help with the stigma, for example?
To be honest with you, reclassifying it does not, it does address the stigma, but not directly. I think knowledge, education, awareness, letting people know that it is not something, it's no longer a death sentence. It is not something to run from. You cannot get HIV through social contact. I think the more people become aware and they're sensitized, the stigma will reduce, because I think ignorance is the driver. When we have our own misconceptions and beliefs without knowledge or evidence, then that's what drives the stigma. But reclassifying it ensures that it is cared for in a way that we care for diabetes, high blood pressure, because many persons are living longer with HIV on treatment. Yes. We have persons in this territory who are living with diabetes over 20 years, and they're living well, they're doing well. Did I say diabetes or HIV?
You said diabetes.
HIV. HIV, many persons are living with HIV longer, and they're doing well. So
you can live longer, people have
yes.
been living longer. Of course, you got Magic Johnson as a premier example.
Yes.
And so...
And right now we're pushing for treatment as prevention, where anyone who's infected with HIV, the sooner you start treatment, the better. It prevents progression to AIDS and helps you to manage the disease better. And as soon as you've been exposed to HIV, so if someone has unprotected sex with someone last night, it's important for them to get tested and to know where they stand. And we have what is called post-exposure prophylaxis, where treatment can be given to prevent HIV
from
prevention.
Developing.
Yes.
Yeah. And so how soon after you've had unprotected sex do you need to go and get that test?
If you have been, for example, we had an incident recently where someone in the tourism sector was exposed to HIV, right? Because they had an open wound and they got in contact with a guest's blood. And they called us right away. It happened at night, like about 11, 12. They called us first thing in the morning. And we sent them straight to the hospital, and they started treatment right away. Blood tests were done, and then they started treatment. And that treatment would prevent them from developing HIV.
And how long you'd have to continue that treatment?
The treatment will be according to the doctor's prescription. She would decide whether it be for 3 months, 6 months, how long, but she will decide.
And once they determine that you don't have the virus because of the treatment, then you don't have to take a treatment
exactly.
again. So it's important to get tested.
Yes. Know where you stand, and do not share your bodies with anyone who does not know their HIV status.
That's the bottom line.
That's the bottom line.
Yeah. So go over to the events and activities again.
Okay, when persons come to the Virgin Gorda Yacht Harbour at Scotiabank BV Limited, Anegada Clinic in the settlement Anegada, and the Jos Van Dyke Clinic in Great Harbour, Jos Van Dyke, on Wednesday, July 26th, they will be offered HIV counseling and testing. A counselor and a tester will be available. And then in Tortola, you enter the park via the parking lot next to First Caribbean Bank, and you get your register, you sign up, you get your health card, and that health card you will use to go across to the BV Health Services Authority. You'll be directed to the BV Health Services Authority table, where you'll be offered blood pressure check. You must have your blood pressure check before you do anything.
Okay.
And then your weight, and then your BMI to let us know whether you're overweight, underweight, just the right weight. Body weight assessment. And then you go to the BV Diabetes Association. You have one finger prick.
Right.
Only one, which you will have your blood sugar, cholesterol, and HIV test done.
Okay.
And then you will have to wait 20 minutes. So within the 20 minutes, you could go across the mental health, community mental health, and see what activities they have. They have games, they have a lot of giveaways.
Or you could get some juice.
Or you could get a drink at Nature's Way, a smoothie, or you could go to Max Live Well and have, I think he's planning to do whole wheat muffins, healthy stuff, healthy food. Once you get your results, you go to the nutritionist and she'll advise you based on the results. If your pressure is too high, your blood sugar is too high, you're overweight, she'll advise you, she'll give you resources. You go see the community dental health staff, and they'll check your mouth, make sure that it's in good condition, and then you go across to the BVI Cancer Society. I know that they have their promotion on, so they will have their recyclable bags and their booklets that they have on sale. The Sandy Lane Center will show us the different types of drugs that people use and their effects. La Ambiance Spa will give you a mini back rub. You know, and we're encouraging persons to make mini donations, mini contributions to our vendors, our community partners, because they're taking their time out of their busy schedules to come and work with us. The HIV/AIDS Foundation will be providing information on HIV/AIDS, and Scotiabank, our wonderful partner Scotia, will be there to advise persons. We'll also have a tent set up to provide the public with sexual health commodities, condoms, lubricants, and all alike. Music, karaoke. If you can sing or you can't sing, come out and let's have a ball, enjoying ourselves for sexual health.
And this is Friday morning at...
Friday morning, 9 a.m. on the dot.
At the Noel
10 o'clock for sure. At the Noel Lloyd Positive Action Movement Park in Rotown.
Thank you very much for coming.
Thank you so much for having me.
Yes, it's always a pleasure. Spotlight, of course, is seen every Tuesday night here on JTV Channel 55, 8 p.m. So make sure you don't miss it. And of course, it's rebroadcast on Sunday afternoons at 2:30. So you can catch up with all the spotlights you've missed. If you miss any part of the night, you can catch it on Sunday. And if you miss the whole thing, or if you miss past spotlights, you could get Spotlight on demand at jtvlive.net. Thank you for watching. Thank you for your words of encouragement. Continue to email me at jtvspotlight@yahoo.com. I'm Edgewenka, reminding you that when the spotlight is on, you see the facts. Peace and blessings.
Spotlight is brought to you by the National Bank of the Virgin Islands, Clarence Thomas Limited, the BVI Tourist Board, and CCT Global Communications.